Lights, camera, action. Okay, good evening. This is Group 8 presenting our 500A case study. Our patient is Petra Katkal. Go to the next slide. There we go. Purpose and course objectives. Course objectives 1 and 2, student learning outcomes 1 through 3. So this is going to explain the pathophysiology of the disease by using clinical manifestations from our case study to link diagnostic treatment of altered health states across the lifespan, identify indicators of mortality and morbidity that impact healthcare and healthcare outcomes across the lifespan. We have an 82-year-old female. She presented to the hospital with shortness of breath and a blood sugar of 325. Excuse me. She has a history of hypertension, COPD, and diabetes with no known drug allergies. Her vitals were a BP of 155 over 92, pulse of 118, respiration rate of 24, SpO 89 on room air, and a temperature of 101.4. The chest x-ray showed a pneumonia in her lower right lobe. She is apprehensive towards men in healthcare. She doesn't like people who aren't her husband touching her. And she's expressed some challenges in adjusting to the dietary lifestyles of America. She has a few different underlying healthcare conditions I want to talk about. First is hypertension. This affects about 75% of people over 60, and that's mostly men. About 500,000 hypertension-related deaths annually in the U.S. cost the U.S. approximately $2 billion in healthcare. Right now, Arizona ranks 16th in the U.S. Petra also has COPD, which affects approximately 6% of all subgroups, mostly smokers, or 1%, 1.5% of smokers. 150,000 COPD-related deaths, making it the 6th leading cause of death in the U.S. And it is a cost of $24 billion on the U.S. Arizona ranks 24th. Diabetes affects about 12% of the population, with over 100,000 deaths each year in the U.S., and it costs $412.9 billion per year. Arizona is 23rd. But Petra came to the hospital for some shortness of breath, and that x-ray found that she has pneumonia. There's over 1 million cases of pneumonia every year, mostly in those colder months, and it results in 50,000 deaths annually, with a 23% mortality rate in the ICU. It's a $6 billion cost in the U.S. healthcare system, and that's mostly driven by the cost of hospitalization. Right now, Arizona ranks 26th in pneumonia and influenza deaths, as shown there by the USA influenza and pneumonia death rate of 2022. So now we're going to talk about psychological impact on the patient, family, the community, and the population.
So the psychosocial impact that pneumonia has on a patient's family, and the community and population is what I'm going to be talking about today. So the impact on daily life influences people's finances, education, employment, and leisure time. In terms of finances, seeking care can be expensive, especially for those that are uninsured or underinsured, and then as those that are dependent on their spouses. In our patient's case, she has other comorbidities such as COPD, hypertension, and diabetes, which can increase her financial burden when seeking care. And then in terms of education, there is a language barrier and or low health literacy can lead to individuals delaying care because they don't quite understand the symptoms and risk factors for pneumonia, which are exacerbated because our patient, she has to rely on her husband to seek care just because of religious reasons. She prefers either female providers or not having her husband in the room with her, as a male provider is helping her. Then in terms of employment, so depending on the severity of the disease, many people miss work just because of the exacerbations of the symptoms of pneumonia. So they often rely on family and friends for help. And then with leisure time, there's an increase in a sedentary lifestyle just because with shortness of breath and chest pain, people don't really want to partake in leisure activities as much as they used to. Can I get the next slide, please? So, in terms of the social dynamic um, of families and communities, so within family roles and relationships, there's an increased reliance on the male family members when seeking medical care due to religious reasons, like I talked about before. So many women, especially in Muslim households, are the primary caregiver when it comes to families. However, when they do have these diseases, they have a strong extended family to help support them in times that they need help. Then with social activities, there are modifications to religious activities. So this may be like going to the mosques or not fasting as often during Ramadan, just because the disease kind of prevents them from fully engaging in these religious activities. And then on the personal health and well-being level, so emotional status, there are negative emotions that come from pneumonia, such as fear, anxiety, depression, and then this could lead to poor treatment adherence, just because there's an unknown, like people don't understand the progression of their disease, things like that. And then in terms of sleep, there's an increase in sleep deprivation, sleep quality, and sleep interruption, just because the symptoms may be exacerbated at nighttime when they're asleep. Then quality of life, there's a poor quality of life associated with pneumonia manifestations. And then in our patient's case, she most likely experiences spiritual frustrations from not being able to engage fully in her religion, which is Islam. So it's important to her to sort of engage as much as she can. And yeah. So Catherine will be speaking about the at-risk populations.
Hello. All right. So I'm going to be talking about at-risk populations. So this being said, starting off with gender, women are more likely to develop severe cases of pneumonia and are 4 times more likely to die compared to men. And then race and ethnicity. So our patient is Muslim. So patient centered care has not been fully explored in this ethnicity. Many Muslim women experience challenges assessing and utilizing healthcare services. And some of these challenges are due to language differences, limited access to care, and family pressures faced by immigrant groups, which affect this population. And then for some genetic factors, so for her genetic factors, I included COPD and diabetes. People with diabetes are 25 to 75% more likely to be hospitalized due to pneumonia. And then also with patients with COPD, they're at higher risk of developing pneumonia because COPD weakens the lung defenses, which can make her more susceptible. And then going into cultural predisposition, Muslim women have specific health needs such as same-gender providers, dietary restrictions, and special needs during fasting. So due to their particular religious and cultural beliefs, Muslim women face barriers in accessing and utilizing healthcare. And then this can create barriers to care and delays in treatments, like when same-gendered providers are unavailable. Then also we know when these needs are overlooked, it can compromise the quality and effectiveness of care, increasing health risks and complications. Now Hannah is going to be talking about epigenetics and environment.
Hi, my name is Hannah, and I'm going to talk about the epigenetics and environment of our patient. So to begin with, the risk factors and the behaviors that influence her disease susceptibility. I think the most important one is the COPD, which, as Catherine said, this increases her risk of susceptibility to respiratory infections such as the pneumonia that she ended up coming in with. And she also has hypertension, which is that high blood pressure, and this can complicate the overall health of her body and just put her body at extra strain, which will increase her risk for cardiovascular issues. And her diabetes, which is a pretty big factor with infection control. And if this isn't managed correctly, then the infections that she can gain will inhibit like her healing process and make everything take longer. Her age, at 82 years old, she's at a higher risk for complications from chronic disease. and infection. And as for her socioeconomic factors, her difficulty of assessing her preferred foods that align with her cultural dietary practices in America can lead to unknowingly poor diet choices since she's not sure what she should be eating or what can align with her views. And as for toxic exposure, although it's not mentioned where she lives, if she lives anywhere with pollutants, and exposure to poor air quality could exacerbate her COPD, worsening her pneumonia and other symptoms. Next up, we have Kelly, and she's going to talk about the anatomy of the respiratory system.
Hi, I'm Kelly, and I'm going to be going over the anatomy. And so Miss Petra came in complaining of shortness of breath, and after they performed her chest X-ray, they discovered that she had right lower lobe pneumonia. So we're going to go over her primary organ system that is going to be affected by this pneumonia, and that's going to be her respiratory or pulmonary system. So over here, there's a picture showing the different parts of the respiratory system. It's divided into upper and lower. Our upper respiratory system, when we breathe in air and get that oxygen in, it helps to maintain a constant temperature and humidify it as it goes down. It also helps to remove particles and bacteria so that it won't get further into the lung system. Some other defense mechanisms that we have is the hairs in our nasal cavity. Those also trap some particles and bacteria. And then in our lower system, we also have that mucus layer, which again is going to trap the bacteria and foreign particles from getting lower into that airway, which can lead to pneumonia exacerbations. We also have those cilia, those little hair-like projections. Those are going to help to kind of bring up some of that mucus so that we can actually then swallow it so it won't get further into that lung. There's also alveolar macrophages. They will phagocytize some of those foreign bodies. And then the surfactant is also going to help protect that the alveolar area. Some of the primary functions that we have with our respiratory system, the main one is going to be that gas exchange so we can get oxygen into the tissues, as well as acid-base balance, which is going to, it's basically helping to control that ventilation rate so that we're able to expel that CO2 if we need to, and as well as blood pressure regulation by angiotensin 2. Next slide, please. Okay, and so 3 things have to happen if we're going to have proper gas exchange. First, we need to have ventilation. It's that mechanical movement of gas from our environment into the lung tissue. Second, we need to have that diffusion, which will take that gas from the lungs and perfuse it into the bloodstream. And last is the perfusion, which is actually going to be taking that oxygen that we've now acquired and moving it out to our tissues. And so with the aging adult, so in Petra's case, there's a few things that can happen. We can lose some of that elastic recoil. We can have stiffening of the chest wall. We can have changes in gas exchange and increase in the flow resistance. And there's also some other exacerbating factors that can kind of influence that as well. Nutritional status, socioeconomic status, environmental toxins, smoking, things like that. And next, we are going to move into the pathophysiology.
Janelle, you're on mute.
Okay, hi, my name is Janelle, and I'm going to be talking to you today about the pathophysiology. And as Kelly said, the patient arrived with shortness of breath and was assessed to have an extremely high blood glucose of 325. Upon examination and x-ray, it was confirmed that the patient has right lower lobe pneumonia, which is an infection that causes severe inflammation in the lungs. This infection causes the lungs' air sacs or alveoli to fill with mucus and fluid, which leads to impaired gas exchange. And that's where the CO2 can't get out and oxygen can't get in, resulting in hypoxia. The inflammation prevents the lungs to fully fill and release oxygen, which leads to difficulty breathing. The magnitude of pneumonia depends on age, overall health, and how it was acquired. The patient's history of COPD, hypertension, and diabetes could potentially affect the recovery process. Complications of pneumonia include respiratory failure, sepsis, organ failure, bleeding problems, and worsening of existing medical conditions. And now you will hear about the progression.
Okay, so the progression of lobar pneumonia begins with a buildup of fluid in the lungs, known as congestion. The next progression is called red hepatization, where red blood cells, neutrophils, and fibrin begin entering the alveoli. Next is gray hepatization, where the red blood cells begin to break down, causing the fluid in the lungs to change color from red to gray. Lastly is the resolution phase, where macrophages come and clear out remaining fluid and other accidents. Okay, next slide. Okay, and then the difference between acute and chronic lobar pneumonia. Acute is typically caused by a bacteria or a virus, and it can only last 3 weeks. And chronic lobar pneumonia is typically caused by tuberculosis or a fungal infection and can last anywhere longer than 6 weeks. Next is Jan Mary talking about the genetic factors.
Hi, my name is Jan, and I'll be going over a few research I found on pneumonia and the factors that may influence people's risk. There's a lot of new research on genetics and how certain genetic factors can increase our risk for certain diseases. One particular article reviewed numerous studies and found a positive correlation between specific variations in the CYP1A1 gene and an increased risk of pneumonia. And CYP1A1 is an enzyme that our bodies naturally produce to help break down harmful chemicals, particularly from smoke and pollution. And there are many studies that suggest that variations in this gene may increase the risk of lung inflammation and respiratory infections, especially those with COPD. The article I found reviewed about 10 studies that involved over 500 participants and revealed that 2 specific variants from this genes are linked to an increased risk of developing community-acquired pneumonia. And this gene variant is also associated with COVID-19. The article did mention that the studies reviewed were a little bit inconsistent, so more research is definitely needed to confirm how our genes may make us more vulnerable to certain infections and diseases. The authors also kind of touch base on how epigenetics can influence our risk of pneumonia, and they found a strong link between environmental factors like secondhand smoke and pollution and an increased risk of respiratory infections. And continuing research about this topic is so important because it could help us identify those high-risk patients at an early stage and offer personalized treatment plans, which I will address on my next slide. There's a lot of studies as well that verify the effectiveness of vaccination. One particular study that I found stated that it can reduce pneumonia risk by 17% and acute flare-ups by 14%, especially among those elderly high-risk populations with COPD and flu shots, and the PCV13 vaccine also provide that additional protection. Although vaccinations aren't always, unfortunately, 100% effective, it is really crucial to educate, patients about it's important because pneumonia and honestly, any respiratory infections can be extremely life-threatening, especially for those high-risk individuals with a weakened immune system or have any history of respiratory diseases, which is what we saw in the pandemic in 2019. And there's also a lot of new promising research that I found in regards to like a silver-based antibacterial treatment, which was shown to be 100% effective against drug-resistant bacteria. And this breakthrough offers hope for patients with respiratory infections that don't respond to antibiotics as this treatment. And it can also offer like an alternative treatment for patients who may have reservations with Western medicine. And as future healthcare providers, we play an important role in educating the risk of pneumonia by creating those personal treatment plans, educating patients on vaccination, lifestyle changes, and environmental risks, and continuing our scientific research so we can protect those high-risk populations and improve overall health outcomes.